So I would like to share my thoughts and my journey into research on yoga, and especially the research on yoga in cancer patients. I've spent almost around 20 years working with cancer patients in various hospitals and trying to see how we can integrate yoga into various aspects of cancer care. I would like to present my journey through a lot of evidence-based research papers and the studies which I have done, which has helped these cancer patients tread the tide of cancer treatment with a lot of courage, conviction, and better quality of life. So I would like to share my screen now. So if when you look at all these lifestyle diseases, you need to have you can see that they have some things which are very in common. One is the physical inactivity causing obesity, the hypernutrition which again causes obesity, and the stressful lifestyle which they lead. All these three important aspects, or these triads we call them as, have a great influence on several non-communicable diseases such as cancer, heart disease, autoimmunity, arthritis, cardiovascular disease, etc. So all of these are chronic in nature. They are there throughout the life. There is no cure for that. The only way you can take care of them is to change your lifestyle for the better, have proper nutrition, reduce your stress, improve your physical activity. So having said that, let us get into details about what yoga is really with respect to cancer. I started my research journey in the year 1998 when I started visiting cancer hospitals, trying to talk and convince doctors that we would like to do yoga for cancer patients. Many of the doctors used to laugh at me. Oh, my patients are very sick. You cannot have them do yoga. You can't have them do the Shirshasana. You can't have them do the topsy-turvy asanas or forward bending asanas. They can't flex. You can break their bones. Exactly. That was very true. Because that day, the understanding of yoga was yoga equals asana to both of them. Yoga equals turning your body, bending your body, and having flexibility of body was called yoga for most of them. But what is yoga really about is not flexibility of the body, it is flexibility of the mind. It is not contortionism, it is not a workout regimen, it's not acrobatics, it is not exercise. It is a science of calming down the mind, silencing the mind, trying to bring about equanimity in your thought processes, in your emotions, in your behavior, and in your coping processes. So the various definitions of yoga, so all it tells you is you may use asanas, you may use the breath or the pranayama, you may use the meditation. At the end of the day, all you're trying to do is try to bring your mind under your control. And this is very important for cancer patients because it is here where they lose hope. It is here where they become very helpless. Let me just give a simple example. A woman is diagnosed with breast cancer. So she goes to another doctor. She goes to another lab. She takes another biopsy done. She gets other investigations done. If somebody tells, with a small hope that somebody tells her that you don't have cancer. This is a kind of social stigma in the society which cancer has left behind. It has left behind a lot of scars, and this causes a problem of denial to many of them. From denial, there is anxiety. Then after anxiety, once they accept and they have depression, they ask the doctor, can I do without chemotherapy? Can I do without removing my breast, without mastectomy, and so on and so forth. They have various queries, and this is very well elucidated by Dr. Kubler-Ross, who was a nurse and who wrote very beautifully about the psychological continuum of cancer patients. So he called it as a DABDA effect: denial, acceptance, bargaining, depression, and anxiety. So anxiety that the cancer after treatment is over, it may reoccur again, they may even have a relapse, or they may even die. Okay, so this is the kind of situation which these patients are endowed with when they have cancer. So let us look at what yoga has done in cancer. So most of you may be surprised that one of the most hardest evidence for effects of yoga as a therapy comes from the cancer patients, because the amount of symptoms, the gamut of symptoms is so exorbitant and so intense that using any form of yoga is not to give some amount of respite to most of these cancer patients. So yoga, if you want to really study the effects of yoga in varied conditions, and cancer is a very important and very better example to set forth. So if you look at all the research articles on yoga and cancer, and you can see more than 500 articles are there today, as on today, with respect to yoga and cancer. And if you look at all these articles, more than 50% of them focus on quality of life, how yoga can improve quality of life of these cancer patients. How does it reduce symptom burden in these patients? So these are very important aspects and tenets of yoga in cancer patients. And today, yoga has become popular the world over, and all the almost leading cancer hospitals, huge medical universities, etc., have yoga classes for cancer patients. Okay, you have the Osho Center for Complementary Medical Therapies, where I also happened to work with and did research in California and San Francisco for 2 years between 2004 and 6. And there too, we have a very huge yoga program for cancer patients going on. A huge program going on at MD Anderson Cancer Center, Jana Faber Cancer Center in Boston, and so on and so forth. So having said this, let us look at the evidence for all these kinds of therapies. Now, when the cancer patients have cancer, they try to take Ayurveda, they want to take yoga, they want to take Unani, Siddha, homeopathy. They take in as many treatments as possible with somebody, with some belief that some treatment would give them some amount of respite. And if you want to look at the evidence behind these therapies, there's hardly any good evidence. Except for yoga, you have about 31% of robust evidence in the form of clinical trials. In Ayurveda, it's just 1%. Unani, nothing. Siddha is nothing. Homeopathy is just hardly 4%. Chinese medicine is hardly 4%. Herbal medicine is again just 10%. And mind body medicine is also 23%. Now, yoga has become the leading mind body intervention in the world over, with a lot of patients taking recourse to yoga interventions when it comes to cancer. And if you see why the patients take recourse to cancer, it's because of this particular reason. It's because of psychological and symptom distress, which is caused due to their impending anxiety. At the same time, is also caused due to the treatment-related side effects. Okay, so both the disease, the treatment-related side effects, as well as the patient's psychological status, all three of them add on to exacerbate the symptoms in these patients. 90% of them have fatigue, 59% of them have anemia, or 90% of them have nausea, vomiting during chemotherapy, 23% have constipation, or have diarrhea, 56% have morphine-induced constipation, and 45% of them have cognitive impairment, and so on. Okay, so this symptom burden and distress in cancer patients is enormous, and it is progressive, and it stays throughout the cancer care, treatment, and continuum. So we wanted to see how does yoga fit into the role of cancer patients if we add yoga along with the conventional treatment which the patients undertake. So when you have a cancer, if it is a localized cancer, if it is one particular part of the body, the best line of treatment is surgery. Okay, if the cancer is loco-regional, it is spread surrounding tissues of the body, then chemotherapy and radiation is also followed up following your surgery. Okay, and if the cancer is already spread to other parts of the body, that's we call it as advanced stage cancer, then you need to give only palliative care or chemotherapy to control the spread of the disease or to prolong the lifespan. So having said this, we wanted to see yoga. How does yoga play a very important role in all these situations when the patient comes with early disease, when they come with a local regional disease, or they come with a metastatic disease. So we want to look at the effects of yoga on symptom control, mood states, perceived stress, salivary cortisol rhythms, immune responses against tumor, DNA damage or genotoxicity because of the treatment, and various other questions we had. And we did several research studies. Even before I go into my research study, I have one small study which I to really talk about, which is on animal models. This is a landmark study published in Memorial Sloan Kettering Cancer Center. It was done in the year 2001 by Anil Sood et al. And later on published by Anthony M.K. et al. In 2006. This is a very important study where they looked at a group of mice. They had 3 groups of mice. So each group was about 30 mice was there in the cage. Okay, and all the 3 groups of mice were injected with breast cancer cell lines into their abdominal cavity. Okay, they want to see how fast the cancer is going to grow. The first group of mice were given electric shock when it went to have its food during the feeding time. So there was some amount of stress given to the first group of mice. The second group of mice was also given electric shock when it went to have its food, but along with the electric shock, it was also given a beta blocker called propranolol, which inhibits the effects of stress. And the third group of mice was not given anything, was allowed to have its food happily. And what they saw was the first group which received stress, about all the 100% of the mice died within 15 days. In the second group, received stress and it also received a beta blocker, half of the mice survived. Okay. In the third group, which did not receive any stress, everyone survived. So this went on to show that Though we don't know whether stress can cause cancer, but we have one particular thing that stress can increase the progression of cancer. Okay, how does it do? There's various mechanisms by producing stress hormones, by increasing blood vessel formation or neovasculature formation, by increasing inflammation, which acts as a signal for the cancer to grow, and by various other aspects. The cancer tissue environment is developed in such a way that it is very, very favorable for the cancer cells to grow. So when your chemotherapy is done and radiotherapy is done, they're all double-edged swords. They kill the cancer cell. At the same time, they also create an environment for the cancer cell to grow healthily and properly again. So what we need to do is to remove that particular soil or the environment. So there was a lot of study again done on meta-analysis, and they showed that patients who had depression, 25% of them who had depressive symptoms, their mortality rates were very high, and those who had clinical depression, their mortality rates were much, much higher. So indicating that if you have depression with cancer, your survival rates are going to be very, very low. And they also found this out that patients with depression cope with it with a lot of hopelessness and helplessness, and they don't have the will to live. And these are the people who really die out of cancer. At the same time, they also do not respond very well to treatment. So we want to look at various aspects of cancer. So we want to look at various problem areas in oncology and want to see how yoga can help in these areas. Fatigue is a very important problem. No solution for fatigue and loss of appetite. Constipation is a very important problem. Dry mouth, neuropathy, blood sores, and emotional well-being, oral mucositis, nausea, vomiting during chemotherapy. So all these are some of the very, very important problems which are very persistent in cancer patients, very common in cancer patients, for which we don't have any solution at all. So okay, the modern medicine doesn't give any solutions. We want to look at literature on using Cochrane reviews in cancer and how many of these are useful and how these systems can be used in cancer. And we found, for apart from all other therapies, yoga was one such thing which had 8 Cochrane reviews, which showed confirmatory evidence for using yoga in various aspects of cancer. So we did a study where we want to look at patients undergoing surgery, especially these are breast cancer patients undergoing surgery followed by chemotherapy and radiation. So we looked at wound healing, immunity, inflammation, and inflammatory cytokines, and anxiety during surgery. We also looked at mood, nausea, emesis, fatigue during chemotherapy. We looked at speech articulation, fatigue, and myofascial pain during radiotherapy. We looked at pain management, fatigue, quality of life, and immunity during supportive care in post-treatment setup, or also in metastatic cancer patients. So if you want to look at evidence for anxiety and depression with respect to clinical trials in cancer, the 141 trials on yoga which talk about reducing anxiety in cancer patients, 136 trials talk about using yoga for reducing depression in cancer patients. Okay, and these are our studies where we have shown how does yoga help in reducing, improving mood states, improves quality of life, and reduces toxicity in breast cancer patients undergoing conventional treatment. And if you look at the meta-analysis where our studies have been quoted here, you can see my arrow, my pointers. So the effect size of our intervention was similar to the intervention seen in other countries as well, indicating that the effects size seen with our intervention is reproducible across populations. And this is very, very important for any research study, as the previous speaker was talking about. So it's not about statistical significance, it's very, very important. What is important about is clinical outcomes. Okay, is it able to be reproducible? Are you able to achieve this kind of a clinical outcome in a study? Okay, statistical parlance is another thing altogether. But if you're able to reproduce the results in other studies too, that means to say your intervention has got a robust clinical outcome. So we also looked at yoga, role of yoga in fatigue, and we know that yoga helps improving better oxygen to tissues. It reduces the energy expenditure. It gives better sleep, improves mood states, and it also helps in reducing cytokines such as inflammatory cytokines. And we did a study on patients undergoing radiotherapy, 44 patients undergoing radiotherapy, add on with yoga therapy, another 44 patients who received radiotherapy alone. And these are stage 2 and 3 breast cancer patients. And we looked at fatigue scores in them, and we saw the fatigue levels coming down significantly in the yoga group. You can see the green ones here, the yoga group, it came down, and interference frequency, severity came down significantly in yoga group compared to controls. We also looked at emotional functions improved in yoga group, cognitive functions too improved in yoga group, social functioning too improved in yoga group, as well as the quality of life in yoga group. All these are published studies in international journals. So we want to look at mechanism of action of yoga intervention, and we wanted to see how does yoga help. So we saw that sleep quality was better in yoga group, and we also looked at cortisol levels. So cortisol is a stress hormone. So early morning, when you get up early in the morning, you feel full of energy and you feel full of drive, And this is called the Brahmi Muhurta, 4 to 6 a.m. in the morning. That is when you have too much of energy to do and all your work, etc. And that is also the time where you say that you also do yoga during that time. Okay, that's because of this hormone called cortisol. It is very high in the evening and it's supposed to slow down in the evening. But in these patients, the cortisol, which is very high in the morning, stays flat. It stays almost flat throughout. Okay, and that is a big cause for fatigue, lack of sleep or sleeplessness, and tiredness in the morning. And what we saw with yoga was we did salivary cortisol levels in the patients 6 a.m., 9 a.m., and 9 p.m. for 3 consecutive days before radiotherapy and 3 consecutive days following radiotherapy. And we did the pooled cortisol levels, and we saw the yoga group having lower cortisol levels compared to controls. And it's published in a very high impact journal called Integrative Cancer Therapies. And we also looked at effects of long-term yoga practice in psychological outcomes in breast cancer patients. And we followed up these patients who were treated in 1998 for 10 years, looked at the cytokine profile, we looked at all the psychological states, and we saw that the yoga group reduced the inflammatory status in the cancer patients, improved quality of life, improved mood states, and also reduced fatigue. And we also want to look at how does yoga can be useful for managing nausea, vomiting during chemotherapy. So one of the main side effects of chemotherapy is your nausea, vomiting, and that is one which is a very, very dreadful symptom which patients don't want to undergo. And patients lose hair. Apart from that, they also have vomiting, nausea. They don't feel like eating any food. And we saw that by giving antiemetics, by giving anti-vomiting medicines, you're going to reduce your gastric motility, and by reducing gastric motility, you're going to cause more nausea. So we want to see by using a simple yoga module done at the bedside, can you improve the tone of the gastric muscle, which is reduced because of your antiemetics, and by improving tone, are we able to take care of nausea, vomiting? And we saw that by third cycle of chemotherapy, the gastric motility was getting normalized using the surface electrogastrogram and in the yoga group compared to the relaxation technique group. And because this study won of the best paper award at American Society for Clinical Oncology in 2013. Okay. So this is one of the important aspects of how yoga can be useful in managing nausea, vomiting during chemotherapy. We also looked at psychological distress, and we showed in our study the psychological distress was reduced with yoga intervention. This is a meta-analysis done by Kramer et al. In 2012, and showed that this also was reduced in yoga intervention compared to controls. We also looked at post-operative outcomes like drain retention, interval for suture removal, post-operative complications, and improved wound healing. And we could see that the duration for suture removal came down in yoga group by 2 days compared to controls. And at the same time, we also looked at immune markers like CD56 counts or NK cell counts, which are known to directly attack and kill the cancer cells. And we saw the CD56 counts were on the higher side, the blue lines on the higher side throughout the treatment compared to controls. Okay, this is also called as the NK cells. And we want to look at how does it help? How does it happen? So we know that cancer treatment like radiation, chemotherapy can cause damage to the lymphocytes, the immune cells as well. Whenever the cell is damaged, you can see on the middle a tail. The damage of the DNA of the cell forms a tail like this. It's called the comet assay. And by looking at the tail length, you can find out how much amount of damage is there in a particular cell. And we are able to see that the amount of damage following radiotherapy in the lymphocytes was increased in both the groups, but probably because of efficient repair capacity of these cells in yoga group, the damage was significantly lesser compared to the controls. Okay. Now, a lot of evidence is gone, and what is important of all this research is it's not about just publishing paper, but once you find that these results are reproducible across studies, then you go on to make what is called as a guideline document. And this guideline document tells you that yoga is one of the very important aspects which can be used for basically for managing fatigue in cancer patients. And if you see that these are the indications where you can use yoga interventions. So these are all the level 1, level 2 evidences based on the robustness of the clinical trials: insomnia, sleep disorders, neuropathic pain, fatigue, headaches, myofascial pain syndromes, dyspepsia, chemotherapy-induced nausea, vomiting, etc. So since 2007, we have almost 10 in-house research studies in that cancer hospital where I was working before I came here. We have 16 ASCO abstracts, we have one ASCO Merit Award, one ESMO presentation, 2 UHCC workshops. Another interesting case study I want to give. This is important for 2 aspects. On the left-hand side, you can see here the patient is a case of renal cell carcinoma, and he's got complete metastasis. He's got the complete spine is involved. You can see the lighting up of the spine, and you can see the deposits in both the kidneys as well, and you can see the humerus, pelvic bone, everything being involved with cancer. So cancer is almost spread to almost all the spine and the ribs as well. And now you see after immunotherapy was given to this patient, and it has been monitored by circulating DNA biopsy, it came down. And this patient incidentally also did yoga. So was into a lot of yoga and meditative programs and nutrition and lifestyle counseling. And this is about almost 6 months of intervention. And we saw a very, very dramatic improvement in this patient. Okay. What amount of cancer burden was there before? It came down drastically using these approaches. And now here you need to be very, very careful because the bone involvement is there. The long bones are involved. You are not going to give backward bends. You are not supposed to give forward bends because these bones are very, very brittle when the cancer spreads there, and they are prone for fractures. Okay, this is a very, very important caution for all of us. So we did more of relaxation technique, more of meditation, more of relaxation, more of meditation, and this is what we found that this patient responded very well with respect to yoga intervention and immunotherapy. Now this is another cancer patient. This is another patient with renal cell cancer who was receiving radiotherapy for the kidney. You can see the one which is lighted up here, the kidney here on the left hand side, and you can see a small lesion number 1 is there in the lungs. Okay, and there's also one more lesion under the head of the humerus or your shoulder bone. Okay, so you had 3 different areas, and you had one adrenal mets, humeral mets, and the lung mets. And what we saw here was when after chemo radiation was given along with this patient, he also did yoga intervention was also given to them. And what we saw was 3 months post SABR. You can see here 3 months treatment and 6 month treatment. The intensity of this came down drastically. So this is a metastatic cancer. Patient would not have survived for long without this, but he responded very well to treatment along with intervention. So when you start adding, because what is important here is when you give SABR, stereotactic radiotherapy to these patients, it increases your antigen load inside your body. And when you give yoga and other things, you're suppressing, you're reducing the effects of cortisol, reducing the effects of stress hormones, and improving immune response against cancer. So when your antigen levels are very high, the immune system is very high, the immune system recognizes the antigen and neutralizes cancer. Okay, it is a part of what is called immunotherapy or abscopal effects, we call them as. And this is what we found in this particular patient. And this was a case report which is also published in a very reputed international journal. Okay, this is the end of my talk, a brief talk about how yoga can be used in cancer. The one important thing here is whenever a patient is there with cancer, they have multitude of symptoms. You also have to know which type of cancer is there, where the cancer has spread, if there is a spread of the cancer to different tissues and organ systems inside the body. You also need to look at whether there are electrolyte disturbances, whether there is anemia, fatigue is because of anemia or not. You also try to look at symptoms of deep vein thrombosis, which is very common in cancer patients. Okay, there are various other things. You also have to look at electrolyte disturbances as well. So you need to, these are very, very important for the reason because if you want to treat a patient with cancer, for example, a patient came with fatigue, and if the patient's hemoglobin levels was 6 gram percentage, and there's no way yoga can really help in this patient because you have to do a blood transfusion to bring up a hemoglobin count so that her functional hemoglobin is 10 gram percentage at least, so that she can do her normal daily activities. And similarly, if the sodium levels are very, very low, it is less than 136, and sodium levels are very, very low, and the patient is confused, is irritable, etc., then you have to look at developing, bringing about proper electrolyte balance. So very, very important to understand here is yoga is not a solution for all the problems with cancer patients. You have to really understand why this symptom has come first. Okay, why this symptom has come first. So only when you understand and know the reason and cause for this particular symptom, that is when you can give the right kind of yoga intervention to take care of the malady or the problem. So it's not that everybody is going to have the same kind of an outcome with respect to yoga intervention. It requires to have a judicious application of both clinical knowledge, understanding, and the right way of using yoga intervention for the cancer patients.